Okay, there's a lot that makes DBT unique, I think, but the first thing that jumps to mind for me is the equality in the relationship and the genuineness of the therapist. It's a real relationship between two people.
What most comes immediately to mind when you ask that question is the compassionate stance towards the clients.
I think that the most unique part of it is that it changes you as a person.
Opposed to a lot of other therapies, it is not trying to be one size fits all.
In DBT, the assumption is that if the treatment doesn't work, it's because the treatment failed or the therapist failed. And that the assumption in DBT is that the client cannot fail.
You cannot actually do DBT without doing DBT on yourself. This kind of treatment you are doing, you react in a different way. You become more wise.
For a lot of folks that we work with in DBT, we're probably one of their only authentic, safe relationships where they can be who they are and then try to be the person they want to be without having this constant fear that somebody's going to leave the relationship.
It is effective and pretty efficient for helping people with very distinct set of problems. And I think that's cool.
So I think this compassionate stance of really not seeing it as one up, one down, but really focusing on an equal level, I think that to this day, I think this remains really unique about DBT, so explicit.
They get to be who they are, and I get to be who I am. I get to use irreverence, I get to use humor, I get to use validation, I get to use cognitive strategies, I get to use behavioral strategies. There's so much that I can do in the treatment as long as I've got the principles in place and the case conceptualization down.